Good afternoon and welcome back to my channel. Today I'd like to switch gears a little bit from what we've been talking about. I'd like to talk about some new developments on the topic of alcohol. Just this past week, the US government revised its dietary recommendations, removing a previous recommendation to limit alcohol to 1 to 2 drinks per sitting. I think this is a bit of a mistake, and I'd like to talk about why. First off, last week also saw a release of a new study through the journal Lancet Oncology. This study, performed by the International Association for Research on Cancer, detailed the impact of alcohol on incidence of cancer worldwide. According to this article, in the year 2020, there were more than 740,000 cases of cancer caused by alcohol. This study isn't perfect. It's an estimate that was calculated by looking at the incidence of alcohol consumption in 2010 throughout different countries and comparing that to the number of cancer cases 10 years later in 2020 and making an estimate based off of what we know on the causative potential of cancer. Cancer is classified as a group 1 carcinogen, meaning it is one of the more carcinogenic compounds we know of, putting it on par with tobacco, for instance. We know that cancer has been causatively linked to cancers of the esophagus, the liver, the breast, the oral cavity, the pharynx, the larynx, the rectum, and colon. This makes it a potentially fairly dangerous substance. So where do I think we should come down with recommendations if I somehow had a magic wand and could tell the US government what recommendations I would suggest? I would actually suggest that we put out a recommendation that anyone who is capable abstain from alcohol. However, I do recognize that experiences involving social events with alcohol are a positive mental health thing for a great many Americans. As a result, I think we should be realistic and say, yes, you should abstain if you can, but if you can't, limit yourself to a maximum of 2 drinks in a sitting. Why that cutoff? Because we know after that we start to see a significant jump in the increase risk of cancer. At higher levels, alcohol also has additional bad effects. We know that higher levels of consumption are associated with damage to the liver, potentially ending in cirrhosis, as well as that increased risk of liver cancer we talked about. Also, we see damage to the heart that can lead to an alcoholic cardiomyopathy, and we see all kinds of bad effects in the brain and the peripheral nervous system. So what is the mechanism by which alcohol causes cancer? Well, what we're aware of is that there are multiple metabolites of alcohol that at any levels are toxic to our body. And these compounds have the potential to alter DNA in such a way that they can cause cancer. So bottom line, alcohol consumption at any level is potentially unhealthy. And we should try and limit the amount of exposure we have by limiting ourselves to at most 2 drinks in a sitting. So one other thing I do want to mention, alcohol also can be disruptive of sleep architecture. This is a separate effect from its effect on cancer and other organ systems. But it is something to note that even having 1 drink right before you go to bed can make your sleep much less restful. Because of this, I would also think that the government should recommend that people confine their alcohol consumption to at least 2 hours prior to bedtime. Remember that men can metabolize the equivalent of 1 drink worth of alcohol in an hour. That is 1.5 ounce shot of hard liquor, 1 5-ounce glass of wine, or 1 12-ounce beer. For women, it's slightly less. They metabolize about 3/4 of a drink an hour. This is why alcohol can potentially more readily have adverse effects on women than on men. All right, I think that pretty much covers everything I wanted to discuss. Please do remember that if you found this content helpful, liking, subscribing, sharing, and writing comments is greatly helpful to me and my ability to continue to make this kind of content. Thanks again for joining in, and we'll see you next time. Please remember the contents of this channel are intended for informational uses only. They do not constitute medical advice and have no part in the practice of medicine. My intent here is to help you have an informed discussion with a healthcare practitioner in your area. Once again, I hope this is helpful, and we hope to see you next time.